This was a study done as a pilot study with my colleagues at the Mayo Clinic in Arizona. That after I transitioned to San Antonio, was taken over by my good friend and colleague, Dr. Gene Palmer. And we were looking at the impact of rope-regulated interferon for patients with early myelofibrosis. Indeed, I am very excited about rope-regulated interferon. It's clearly had very favorable data in PV and may become approved on that basis. Dr. Serge Rostovchik and I are co-leading the global phase 3 study of rope-regulated interferon as second-line ET. Now, it's natural to ask the question whether this therapy might be beneficial for patients with early myelofibrosis. It's previously been shown, both by the French and Dr. Dick Silver, that there is activity of interferon in myelofibrosis, particularly if used in more early disease. Individuals with very advanced splenomegaly, very fibrotic bone marrows, marked cytopenias, probably not the ideal group, so much earlier myelofibrosis. So in this pilot study of 10 patients, where we were really looking both for tolerability and activity, we saw, one, the drug was well tolerated. We had median follow-up now of almost 3 years for these individuals. We had, even though many of these were low or intermediate risk individuals, in the low risk cohort, there were 3 individuals that had benefit out of the 3. In the intermediate and higher risk cohort, we saw a clinical improvement in 30%, stable disease in the vast majority, 57%, 1 patient progressed. So clearly, progression-free survival was part of our goal in that therapy, and on that aim, overall very successful. Patients received up to 47 cycles on this particular pilot study, and overall we view it as a very favorable pilot study, showing safety and efficacy for this population. Clearly would need larger studies, randomized potentially against other standard approach or observation. The goal with the eligibility for this study was not individuals who normally would have been treated with a JAK inhibitor, but these are individuals who otherwise would have normally been observed. But we were, again, looking for activity and progression-free survival. But excited to see that and feel that a rope-regulated interferon likely will play a role in early MF. It may also be a natural fit, of course, with people with ET or PV who have evidence of movement toward fibrosis.